Acclaim Health helps about 25,000 people every year across Halton, and most of those people are older adults. So we do a lot of different things. We have home nursing and personal care, dementia care, a lot of support to reduce social isolation, falls prevention, and hospice and bereavement care. So that's kind of the broad spectrum of what we do. And today I'm going to tell you a little bit about our dementia care program. So today I am sitting in our Burlington Adult Day program. And our adult day programs are really there to support people living with dementia and give them a really rich environment that they can be in, and also to give their family caregivers a break. Of course, I will give you a tour in a moment. It's not exactly a tour in action because, of course, we don't have any clients here right now. And that is due to the pandemic. Given the demographic that we serve, they're most at risk of COVID-19. So we've had to be really careful about that. So we're supporting them in other ways. And I don't want to talk about the pandemic too much, except to say it has given us a really unfortunate glimpse of what life would be like if our programs didn't exist. Because right now, a lot of our programs have had to be disrupted and we're operating them in very different ways. And people aren't getting the same support that they would normally. And you can see just the horrible effects of that. We've had a lot of people with dementia who are now just sitting at home and have been sitting at home for 3 months, very isolated. A lot of them have lost their ability to communicate. They've lost their ability, they're losing their faculties of communication because they're not really seeing new people or talking to new people. We've had a lot of people with dementia who are sick of being at home and they don't understand what's happening. So they're going for walks and leaving the house without their family knowing. So we've had a few, we call those elopements, which is a nice word for a really scary thing to happen. We have a lot of family caregivers who are locking themselves in bathrooms because they just can't cope anymore. They're like, I'm done, I can't deal with this. You know, there's some really serious situations happening. And on top of all the mental health issues, we're seeing a lot of our clients decline physically because they're not getting exercise. They're, as I said, they're basically just sitting at home. So we're hearing of a lot more falls. And of course, with falls come the risk of injury. So there's a lot of serious things happening, and we are supporting those people virtually. We're supporting all the caregivers. Thanks to the United Way and the emergency funding, we've been able to put in some respite for the most at-risk families, which has been exceptionally, that's just been extraordinary. I mean, really, truly, you are saving people's lives with that. So you should feel really good about that. And I'm, you know, one of the things that we do here at the program is make sure that people have that really rich environment. So I'm going to take you around and show you. So you can see, this is our bright and sunny day program here. This is our kitchen where our clients would normally congregate in the morning and have coffee. They get to chat to each other. They make friends in the program. We call them club members because nobody wants to really go to an adult day program. You can see our very resort-like outdoor patio right now. It's beautifully sunny. Hopefully you can see that. So we have an outdoor space. Everything is secure, so people can wander and be as independent as possible within our space. We don't want people to feel like they're different. We don't want people to feel like there's any wrong thing that they can do. So we often have baking here. They have coffee here. People participate in all these activities. And I'm going to kind of walk you through here. This is the space that's kind of been turned into our activity package warehouse. You can see we do a lot of art here in the program. Clients usually really respond to that. It gives them a sense of purpose and makes them feel like they belong and that they can still do things. That's one of the great benefits of our program. And right now you can see that we're busy assembling activity kits because we are dropping these off at people's homes. One of the things we have done through the pandemic is to do a lot of virtual programming and to give families ideas of things that they can do with their loved one at home to keep them occupied in an effort to sort of retain those abilities and to give the caregiver a break, because that's really essential as well. And you can see that it goes on. We have more program rooms back there. We use a lot of technology and things like that in the space. One of the things that these programs really offer is the ability to keep people living in their own home as long as possible. If people can come here and can have fun at the day program, and the caregivers don't need to feel guilty about dropping them off here because they always have a good time, they come out smiling at the end of the day, then they can stay in their own home. They don't need to go to long-term care before it's absolutely necessary. They don't end up in the hospital because the caregiver's burnt out. So this really offers a solution that benefits not only the families and the clients, but also the healthcare system as a whole. And as you can understand, you know, over the last few months, we have had a lot of families who do not want to put their loved one in long-term care. Long-term care has been a nightmare over the last 3 months with the pandemic. And you've seen, unfortunately, the struggles that the long-term care sector has had in trying to care for people. So as much as we can, keeping people out of that environment is best for everybody. Really, and I think that's what we all want. Nobody wants to go to long-term care. Everybody wants to be as independent as possible. And I think one of the best things about this program is you can see when people start here, particularly for our club members with dementia, they know usually when they start, it's been, you know, a bit of a journey to that point, and they know they're not the same person they were. And that really degrades your self-worth and your self-esteem. And it takes a lot of energy to be in a social situation when you know your brain isn't reliable. And so they're stressed and they're burnt out because they've been trying to keep it all together, and they're trying to act normally in their normal social situations. And they come here, and this is a place where they can totally be themselves. And you see them after the first few days just totally relax into this space because the staff are amazing. There's no, they can't do anything wrong. Where we meet them where they're at. And each day staff design programming around the people who are here and their unique abilities and personalities and interests. So it's very tailored to the people who are here every day. And I think that's what's so amazing about it and why our results are so incredible, because there really is that attention to individual detail. And you can see that weight just gets lifted off of people's shoulders. And we see a reduction in behaviors. We see a reduction in anxiety. As I said, sometimes people start to speak again when they haven't spoken for a long time at home. So those are really wonderful things. It's a disease that only has one direction. We're not going to cure anybody, but we can certainly improve their quality of life while they're with us, and relieve a terrible burden of stress on the caregiver. So I would just like to say thank you to all of you. When you're involved in the United Way, what you're really doing is providing that safety net for families across Halton. They could be families like yours and mine. Everybody's getting older. Nobody is immune to that. So these are programs we all might need one day. And I think that's important to remember. And especially during this time, you know, a lot of the charitable sector is struggling to keep programs going. They're needed more than ever. And so that stability is key. And the United Way does an incredible job of that. It's that sort of backbone, that reliable backbone that all of our organizations and programs know is there, and that we can use that to move forward and deliver the things that this community needs and that families need. There's a lot of serious issues that all of our organizations deal with, but the joy of it is in making all of those difficult situations better. So I hope that's what you take forward. Thanks so much.